Hello, everybody. Welcome to the Wellness Hour. I'm Esther Tro. Today's topic is weight loss and bioidentical hormones. And joining me today is Randy Alvarez, who is the CEO and founder of the Wellness Hour. And you've teamed up with Dr. George Weiss for the Longevity Center. Tell me about that project.
Well, you know, our logo and brand, WH, stands for Wellness Hour. So, and we're very careful, you know, not to, do a bunch of different things. But because this has been my passion for the last 20 years, we decided to finally open up this WH Longevity, which is a partnership with the Wellness Hour, which is my company. So I'm the president of this Longevity Center, teamed up with Dr. George Weiss. I've been in and around this doctor, cutting edge doctor, for the last 10 years. So it was just the right time.
And tell me more about the center itself. What does it provide for a client?
Well, it's very unique. You know, I think that it's the only center of its kind that is focusing on weight loss and bioidentical hormones, but for the aging population, 35 plus, specifically women in perimenopause, premenopause, or menopause that have a different type of weight loss needs. So this is really a specialty practice that deals with weight loss and hormones for those women that all of a sudden, 35, 38, 40 years old, or those men that hit the wall, can't lose weight the way they used to. Maybe their energy is going down, their libido is going down, and they want to lose those extra pounds.
And nutrition is also a key component of this, right?
Yeah, you know, my background, the Wellness Hour, people ask me, how did the Wellness Hour start? We air first up, 5,000 half hours. We spend about $650,000 a month airing the show nationwide and Canada, and doctors flying from all over the country. But where I started, I was a nutritionist within a longevity center that I founded in Palm Springs, California. And one day the cable company came to me and said, hey, why don't you guys do an infomercial? And I said, I don't want to cheapen the doctor with an infomercial. And but I heard about the cost of airtime, and I got excited about it. And here I am, I'm the nutritionist in this practice. So we hired a host, and we thought, let's do a real medical talk show where we're asking the questions. The doctor tells the truth as they see it. So it was real. Sure, there was editing, but it was real. And the host didn't show up that day. So I'm the host. We had no name, and I said, let's just call it the Wellness Hour. Went on TV. It was a huge success. And it became one of the most successful integrative anti-aging centers in America.
So clarify for me, are you endorsing the doctors on this program, or how does that work?
Now, in this particular case with Dr. Weiss, teaming up with him, I'm absolutely endorsing him. I purchased the company. It's my business. I'm a partner with Dr. Weiss in the WH Longevity. And I always say on every one of my shows, I'm not endorsing the doctors. I'm just asking the questions. And that's the truth of the matter. In fact, even when you go to wellnesshour.com, it's not my personal endorsement. And if you want to be a credible show, first of all, they don't pay to be on that website. That is not a referral website. It's really so that people can watch the show, make a decision, and be the judge. And but along the way, and how I got started with this WH Longevity, this is not a new, some new idea that popped in my head. This is how I started. I was speaking on the road, teaching medical doctors how to open up weight loss and bioidentical hormone practices in their cities. And it actually came out of frustration. And Dr. Weiss and I have been trying to team up on weight loss and hormones for 9 years. He's been threatening to finally come and work together with me. And one day we just at dinner, we said, okay, let's finally put it together. Let's make the most comprehensive center in the world.
Let me ask you, how does this wellness center differ from other weight loss centers?
Just that we specialize in weight loss for the aging population, for women in the menopause, perimenopause, premenopause, that all of a sudden can't lose weight the way they used to because they have a different metabolism at this point. There's certain hormones that go up, for example, insulin and cortisol that go up with age.
The stress hormone.
Women, all of a sudden what happens is, their estrogen progesterone ratios all of a sudden get offset, affects weight gain, their testosterone starts to go down, and they start losing cellular energy. So what ends up happening to the aging population is their metabolism slows down because their cellular energy slows down. And there's things to stop or slow that with new breakthroughs in medicine, cutting edge information that's coming out every week. So we've jammed it in this program. It's the weight loss program for the aging population.
Is that why you hear a lot of women who are going through menopause saying, I just don't feel good anymore. I don't know what it is. I don't have any energy. Explain that to me. Why do women come to you and say, I need something to change how I feel.
Okay, not everybody, as you know, comes to us for weight loss. And I asked you your permission. I said, could I put you on the spot?
Yeah.
You're physically in great shape. I mean, we've seen you, you're in great shape, but your energy was low.
Right.
And I told you, because I wanted you to interview me, I said, you don't have to feel this way, by the way.
That's right.
And you were skeptical. You say, I come
was
from a
very
medical
skeptical.
background. Did you say that?
The way doctors prescribe hormones now is very different from this bioidentical process. So for me to switch over, I kind of thought, well, I'll try it, but I just don't know if it's going to work. And I'll tell you, it has made a difference in how I feel.
And you're a news anchor, so
I am.
You're also a skeptical person.
I
and
have
you come
to be
from
by
a
nature.
medical background.
That's right.
We get a sophisticated group of people. So with you, your symptoms, and we looked at the nutrition, gave you some hormones, you feel different.
Feel much better,
Completely
much more
different.
energy. Yeah, and I always say, well, is it specifically because of the hormones, the nutrition, a combination? I have to say, every approach is probably a combination of things. There's not just one thing that's going to make somebody feel better. So,
but the side effect you'll get leaner. That's
yes,
for sure.
Hopefully.
Right? Has it happened?
Well, I just started. I'm brand new to this program, so I just started, and
been like a couple weeks. I guess.
yeah, a couple weeks. So the jury's still out, but we'll see. I have high hopes.
Okay, good. You're sleeping better. You have more energy, more focus. Those kind of things. Those are all true.
Yes.
Okay, good.
Yes.
Good.
All right, so let's go back to weight loss for a second. Have you ever personally had a problem with weight loss?
Absolutely.
Tell me
In
about
fact, since 10 years old, I knew I was hungrier than my friends. I had a big ravenous appetite. And when I reached 38 years old, one day I hit a wall. I started gaining weight.
Yeah.
And I always had to battle it a little bit. But I got 44 pounds exactly. I added it up before I got in here. 44 pounds heavier than I am today.
Wow.
And
significant.
I damaged my metabolism, but it was hormones. It was the way I was eating. It was, of course, at the end of my fork what I was eating. But I had no, my cravings were out of control. So with Dr. Weiss's help and with some of the information that I knew, look, I knew what I had to do, but I wasn't doing what I know. So we had to go back to the basics. I'm in good shape now. I feel better. My abs are starting to come through. I want to go to the next level.
Yeah.
And
it feels good.
Yeah.
Well, let me ask you, you just mentioned something. You said, I damaged my metabolism. And I've noticed that in some of your paperwork that you say you can actually jumpstart your metabolism. Tell me about that, because I don't know much about that.
Well, one of the things when, back to the aging population, this weight loss program is for that aging population. As you get older, there's certain hormones that go down, like testosterone in male and females, okay? Women, estrogen, progesterone, DHEA. And so what happens, and sometimes there's age-related thyroid problems as well, or some people just have a low thyroid. And so when you do a hormone panel, whether it's saliva or blood, you look at it, and what happens is, when you get older, your metabolism slows in a way. That cellular energy slows. So when you replenish those hormones, it's like cheating, You replenish those hormones, you control the things like cortisol and insulin that go up and damage metabolism. By eating high carbohydrate meals for many years, you become a little bit insulin resistant, maybe even develop hyperinsulinemia.
Okay.
And through the type A personality, burning candle at both ends, that with this cortisol, you damage your adrenals, so you have to heal the adrenals. But once we put this all together, and it may sound a little bit complicated, but once you put it all together, especially in my case, because I was stubborn, I didn't take hormones. And so when I put it was that hormone edge, we call it, when I got the hormones involved with the proper nutrition, and in some cases an appetite suppressant. And I would say, that gives you that jump start. Because once my cravings were gone, one of the things Dr. Weiss got through my thick head is those out of control cravings aren't natural.
Right.
That when we wipe those out, then now for the first time, logically, I could say, I don't want pizza. I don't want a cookie. I don't want a hamburger, whatever. And so that's the goal. Our program, what we're great at doing, what Dr. Weiss is great at doing is, and I oversee the nutrition, this is my background, and that is that we need to wipe out the cravings so that way people can do it. But there's several types of dieters. There are people that really have very little appetite, eat very little, and they can't lose weight.
Right.
Then there are those people that are like me. If they have one piece of pizza, they have to eat the whole pizza, or they have to write off the day. There are certain people that just have big appetites. They know they shouldn't eat the Cheetos. They know they shouldn't eat cheese bread or pizza, but they can't say no.
Yeah.
And really the most difficult, not for us, but the people that eat very little and they can't lose weight, or they're gaining weight.
Now tell me about the appetite suppressant, because a lot of people, have heard negative things about those.
Yes.
So tell me more.
Well, Dr. Weiss, of course, after blood work, uses it as, and there's several, by the way, certain ones that control serotonin, appetite suppressants, some are cardiac stimulants, you have to be very careful. But the main thing, depending on the medication, and there's at least 10 different medications that can be used, and this program is now all about medication to wipe out, but for certain people, to give them that jump start, Dr. Weiss offers a medication, helps their cravings, and gets them started, a jump start.
Yeah.
But we believe, and I'm going to quote Jenny Craig on this. I met her. She said, maintenance starts today. Starting people out right at the beginning.
Yeah.
So that way, we don't believe in a lot of fasting or 250 or 500 calorie diets.
Okay.
Because it has to be realistic.